Assalamualaikum warahmatullahi wabarakatuh. My name Muhammad Akmal Shah bin Saim. ID 12214120198. So for my presentation today is acute radiation syndrome. So this video presentation should provide a comprehensive overview of ARS, including its causes, progression and symptoms, treatment options, and prevention strategies. So we look. Okay, the first I give a brief overview of the introduction and causes. The acute radiation syndromes are caused by a sudden large dose of radiation to the body, and depending upon the dose level, one will experience either cerebral vascular syndrome, gastrointestinal syndrome, or hematopoietic bone marrow syndrome. Okay, then I talk about what is radiation. Okay, of course, radiation can be described as energy or particle from a source that travel through space or other mediums. Light, heat, and the microwave and radio wave used for wireless communication are all forms of radiation. Radiation include particles and electromagnetic waves that are emitted by some materials and carry energy. The kind of radiation discussed below is called ionizing radiation because it can produce charged particle of ions in matter. So X-ray, gamma ray, alpha particle, beta particle, and neutron are all example of ionizing radiation. Okay, looking at this slide, we can see the 4 stages of acute radiation syndrome. And the first one, primordial stage, iaitu NVD stage. The classic symptoms for this stage are nausea, vomiting, as well as anorexia and possibly diarrhea, depending on dose, which occur from minutes to the following exposure. The symptoms may last episodically for minutes up to several days. Okay, the second stage is a latent stage. In this stage, the patient looks and feels generally healthy for a few hours or even up to a few weeks. And the third, manifest illness stage. In this stage, the symptoms depend on the specific syndrome and last from hours up to several months. And the fourth, recovery or death stage. Mostly patients who do not recover will die within several months of exposure. So the recovery process lasts from several weeks up to 2 years. Okay, this chart is you will notice on this chart for the syndrome. Is a cardiovascular, CV or CV, central nervous system, CNS. So it's a dose 100 GY total body dose of X-ray, and then prodromal stage as a symptom extreme nervous and confusion. Okay, and then latent stage is a patient may return to partial functionally. This stage may last for hours, but often it's less. And then after that, the manifest illness stage. The symptoms are return of water diarrhea, convulsion, and coma. So after that is a recovery. So for recovery, no recovery is expected. Okay, for the syndrome hematopic, those 2.5 to 5 GY. Primordial stage, the symptoms are anorexia, nausea, and vomiting. And then at latent stage, stem cells in bone marrow are dying and manifest in the stage. Symptoms are anorexia, fever, and malaise. And the last is recovery. In most cases, bone marrow cells will begin to repopulate the marrow. And then the syndrome gastrointestinal or GI. So for those for GI, it's 10 GY. And then primordial stage symptoms are anorexia, vomiting, nausea, and the latent stage stem cell in bone marrow. And then the manifest illness stage symptoms are malaise, anorexia, fever, and diarrhea. And the recovery, the LD 100 is about 10 GY. Okay. And then as I pointed out early, the treatment. So for the treatment to promote the growth of white blood cells, and then the blood transfusion of red blood cells and platelets can restore the damage. And then potassium iodide, this treatment can help keep your thyroid from absorbing too much radiation. So for the nausea treatment can help control nausea. Okay, as I mentioned earlier, prevention strategies. So for prevention strategies, the best way to prevent radiation injuries and illness is to get inside as sun as possible, away from the radioactive material outside. And then the head effect of radiation depends on the amount of radiation absorbed by the body or dose. And if you have skin burn, nausea, or begin vomiting shortly after radiation exposure, seek medical attention as soon as it is safe to leave your building or place of shelter. And then this may be symptoms of acute radiation syndrome, which is caused by exposure to large amount of radiation over a short period of time. And then the symptom can appear within minutes to several days after you were exposed to large amount of radiation. Okay, that's all. After that, I'd like to show you this video about acute radiation syndrome process absorbed to the body and effect from causes. So we can learning from this video. Okay, you can enjoy, and from the learning, thank you very much.
The lower end of the spectrum, so there is no risk of ionizing radiation from their use. The biggest health risk occurs when lots of ionizing radiation hits us in a short time period, also known as an acute exposure. Acute exposures overwhelm the body's natural ability to repair the damage. This can trigger cancers, cellular dysfunction, and potentially even death. Fortunately, acute exposures are rare, but we are exposed daily to lower levels of ionizing radiation from both natural and man-made sources. Scientists have a harder time quantifying these risks. Your body often repairs damage from small amounts of ionizing radiation, and if it can't, the results of damage may not manifest for a decade or more. One way scientists compare ionizing radiation exposure is a unit called the sievert. An acute exposure to 1 sievert will probably cause nausea within hours, and 4 sieverts could be fatal. However, our normal daily exposures are far lower. The average person receives 6.2 millisieverts of radiation from all sources annually, around a third due to radon. At only 5 microsieverts each, you'd need to get more than 1,200 dental x-rays to rack up your annual dosage.